So body acne includes your acne breakouts that occur on the chest, back, neck, shoulder, upper arms, and butt. If you're experiencing acne in these areas or know someone who is, you're going to want to share this video with them, and stay tuned because I'll show you guys some effective ways to get rid of it and keep it at bay. Also guys, do me a quick favor and hit the like button down below. It helps this video get found by more people, and you also help make my day too. And just for liking the video, here's a picture of a cute baby sea otter. Just like you can get acne on your face, you can have non-inflammatory acne on your body, like blackheads and whiteheads. You can also have inflammatory acne too, like papules, pustules, nodules, and cysts. And the key to getting rid of the body acne involves clearing the pores that are clogged with oil, skin cells, and bacteria, and also maintaining the skin area afterwards. I'll break down the video in 5 areas with each in their own timestamps to help you navigate this video better, starting with the first being the causes of body acne. So let's talk about the causes. There's about 5 main ones, and chances are your body acne, whether it be back knee or chest knee, is tied back to one of these reasons, so pay attention. The first is from exercise and sweating when the skin area isn't thoroughly washed off or cleansed afterwards. Sweat combined with heat and friction can create a nice environment for the normal microorganisms that live on the skin to blossom, and when they blossom, they can create breakouts. There's a form of acne called acne mechanica, which results from the rubbing, tugging, and chafing from your uniforms, Lululemons, workout gear, and even your backpacks. So pay attention if your body acne is a result of this. And speaking about showers, I want to give you guys a game-changing tip here. Washing your body should actually be the last step of your shower routine. Why, you might ask? When you use your conditioner residue drips down your back, chest, and other parts of your body, right? It can clog your pores and cause what's known as acne cosmetica. When you use your conditioner at the very end, the risk of body acne for some people goes up because you're not washing your body off again, and the comedogenic products gets into your skin. So save the body wash after the conditioner for the best results, and don't allow the conditioner or shampoo to run down your back. The second reason why you have acne on your body is from the foods you eat. This doesn't affect everyone, but certain foods, especially cow's milk and highly glycemic foods, can contribute to body acne for some people. The third reason is family history. If one of your parents has a history of body acne, you may be more prone to it as well. And this isn't because of an acne gene or anything. It more so has to do with the biological trait that makes you more prone to pore blockage. The fourth reason is hormonal. You see, androgens are our reproductive hormones, right? This includes testosterone, which is present in both men and women. When this is imbalanced, androgens can cause skin changes, like more sebum or oil production, changes in the skin cell activity, and inflammation. And it's this imbalance that can happen at any age, and you may experience it more just as you're about to experience a period, for example. Just before the bleeding begins, your estrogen levels fall, and this allows more testosterone to bind to sebaceous gland receptors and stimulate sebum production, which leads to the body acne. But on this note, there are other endocrine disorders such as PCOS and adrenal hyperplasia that can also contribute to body acne too, or if you're using testosterone, for example, in bodybuilding. These all play a role in hormonal causes of body acne. And lastly, the fifth reason is stress. Stress causes the release of cytokines, which are small proteins that bind to receptors in the sebaceous gland and activate an inflammatory response. Also, stress impairs the immune system, if you didn't know already, making it more difficult for the body to fight off bacteria. Also, pay attention next time. It can take longer for acne breakouts to clear when you're under stress too, which is interesting. So now that we covered the 5 main causes of body acne, you can identify which one yours can be tied back to. Let's talk about what body acne is actually commonly mistaken for, which is folliculitis. Folliculitis breakouts also can occur on the back, chest, and shoulders. They are small bumps that look like acne, but they will appear on a hair follicle and cause inflammation on the hair follicle itself. A big difference is that folliculitis can also be itchy. So for example, if the pimple is on leg or butt, it most likely is folliculitis. And healthcare workers and athletes are particularly more prone to it. We'll talk about how to get rid of that too at home, but for now, let's turn our attention to how to get rid of body acne, which is why you're all here. We have 4 methods available to us: a salicylic acid wash, a glycolic acid wash, a benzoyl peroxide wash, and a retinoid cream. If you're stuck between choosing a salicylic or glycolic acid wash versus benzoyl peroxide, let me tell you a trick. Benzoyl peroxide works better for inflamed pimples where they are more red, while salicylic acid is good for acne bumps and blackheads. So depending on what yours looks like, choose the right wash. For salicylic acid, you can go with the SA Body Wash by Cerave or the Paula's Choice Salicylic Acid Body Spray as two great options. If your skin is on the sensitive side, then go with the Cetaphil 2% Salicylic Acid Body Wash, which can actually work better for some. For glycolic acid, the Naturium one gives a good exfoliation and helps attack the body acne as well. Links for all these will be in the description box down below as my affiliate. So if you wish to support the channel, you most certainly can by purchasing through the affiliate links. They aren't sponsored. As far as benzoyl peroxide goes, Cerave uses the 10% benzoyl peroxide for body acne, which is a great formulation. And if you want it to, in a soap form too instead, then go with the one by Panoxyl. These are both 10% ones, which work great for some, but for others can be too harsh. If it's too harsh for you, then use Cerave's 4% benzoyl peroxide wash instead. And the best way to use it, you want to apply it to damp skin in the shower, leave it on for a few minutes so it has enough contact time with the skin, then wash it off. Just keep in mind that benzoyl peroxide can stain your clothes, so before getting dressed, make sure the product has thoroughly dried on the skin. And since the skin on the neck is pretty sensitive, you want to use products slowly and carefully in this area. So if you notice excessive irritation, dryness, or peeling, go ahead and scale back or discontinue the product and consult your dermatologist. And as far as folliculitis goes, it depends. If it's bacterial folliculitis, the best way to control it is to wash it with an antibacterial soap 3 times a week for a month. And if it continues, go back and do it again. But if you have pytyrosporum folliculitis, using Selsun Blue actually, or asking your doctor for a prescription for 2% ketoconazole shampoo could do the trick as well. The 3 areas that you want to focus on if you have folliculitis are behind your ears, armpits, and your groin. You don't want to only wash the areas that you get pimples on. You want to wash the areas that harbor the bacteria, which is the armpits, groin, and the back of the ears, which is another bonus tip. And speaking of how long it should take to work, you should notice improvements in about a month's time or about 1 full skin cycle. If not, wait till the 3-month mark. If you don't notice much of a difference after about 3 months, or the acne is leaving scars, see a dermatologist as well. But more severe body acne may actually require retinoids, antibiotics, dermatological procedures, or even hormonal therapy. Now let's move on to lifestyle changes that you need to make while addressing the body's acne, and this applies to folliculitis too. There's about 7 I want you to take away that if you do them, they will make a huge difference, and I'll keep them quick. 1, shower after workouts and change out of sweaty clothes right away. 2, minimize friction, and this includes bra straps that can be too tight. Wearing loose clothing can actually be a game changer for some folks, especially if you have painful body cysts. 3, avoid popping them. This can lead to further inflammation. Number 4, choose the right products. What I mean by that is make sure they're all non-comedogenic, which means they won't clog pores. 5, avoid using washcloths, brushes, or loofahs in the shower. These collect bacteria over time, and you can actually transfer bacteria into your skin follicles and make things worse. On top of that, make sure you're using clean towels each time you shower and not the towels that are near your toilet, which is a very common mistake actually. 6, wash laundry more often. Sweat, makeup, and other products can leave remnants on fabric, which is why you got to make sure that you're doing your laundry consistently. And this means your bed sheets and pillowcases too. And lastly, number 7, limit your intake of high glycemic foods. This can be a game changer for some. In the meantime though, I'm curious to hear from you guys now. What are your thoughts on body acne? What has worked for you? What has not worked? Leave them in the comments below, and if you want more meaningful conversations in the comments, let me know what you want answered. If you found this video useful, subscribe to the channel, and I'll see you guys on the next one.